thank you to all of you for giving me this honor. It's not every day that you get a men's dominated group or a man's group inviting a woman to come talk about something related to men. And so I doff my hat off to all of you. My name is Dr. Rosemond Osei Kranting, as I've already been introduced. I'm a medical doctor by profession. My area of specialty is radiology, but I've always been passionate about health education. And so I'm really privileged to be here to talk to you about prostate health. Before we zoom in on the prostate, I'm going to make a few general remarks related to health. And I was told that this is 1999 year group. I also finished the Ghana National College in 99, and so I know that it's very likely that I'm of similar age to most of you, probably plus or minus a year or two. And so I want to assume that a lot of us are around 40, early 40s, they're about mid 40s, or probably early 30s. So somewhere around the 40th mark, and we've heard it said over and over again that life begins at 40. And so most of the things we did before 40 years, we are just actually gearing up there for the real life that lays ahead of us. Unfortunately, I've come to realize now that because of so many health issues plaguing us, by the time we hit our 40s, some of us are never able to enjoy the kind of life that we have waited to live after 40. But it is also important for us to note that 40 is now the new 20. Into do 40, I feel cry no abeya brantie. And so we need to move from that place where health is a reactive thing to being proactive about our health, so that we can enjoy our life even at 40 and beyond. Now 40 is not old man, it's not even middle age. Unya 40, I feel cry na brabono. And to a few general comments, midlife begins just around 40, 45 years. And it is a very critical time for us to transition from where we wait till we have pain or ache somewhere in our body before we rush to go and see the doctor, to we being proactive, meaning that even before you feel unwell, before you feel there's something wrong with you, you are checking into hospital periodically to have some things checked, so that we'll be able to pick certain things before they become full-blown disease that can be life-threatening to you. And it is important that we do so, because at this age and beyond, we have increasing stress in our lives. You have a caregiving roles. If you are a very involved father, you have growing children, you have aging parents, there are career shifts. This is the peak of your career life, where you are trying to rake in all the money you can before you start becoming too old to chase after the big cash. And your metabolism at this point becomes slower because your testosterone level will start to decline. Every year you lose about 1% of it. And so at 45, the energy you have is very different from the energy you had when you were 35 or 30 years. And then, of course, unfortunately, with increasing age, you have the increased risk of cardiovascular disease, metabolic shift, cancer, and all that. Don't worry, I'll get to the prostate in just a minute. And why do we need to be proactive? I really appreciate you for taking this initiative. It is one of the things we do in relation to being proactive about our health. It is because a lot of things that would kill us, if we find it early, there are a lot of things we can do to make sure that it does not kill us. The hypertension, the diabetes, the prostate disease, the cardiovascular disease, they usually will not give you any symptoms until it is life-threatening. There's no pain until they strike you down. And so you need to check so that you pick it up early before it is too late. And then, of course, your quality of life when you don't have any of these chronic diseases is very different from when you have some of these chronic diseases. Because now that you have money, suddenly you are told that you can't chew meat. There are so many things you would have loved to eat, but now because of diabetes or hypertension or high cholesterol, you are not able to eat these things. And then lastly, understanding our health empowers us, because now it makes you to make very informed decisions about your health. You know that you need to go and screen for A, B, C, and D. You know that you need to be checking this thing every year or every 2 years or every 3 years. And that really is empowering. For starters, for every one of us, you need to know what your family history is like. What are the things that are running through your bloodlines? Of course, we believe in prayer and counseling some of these things in prayer, but the reality still remains that we have come from a genetic pool. And so in your family, is there anything that is running through your family? Is there something you need to be really screening for? And at what age must you start screening for? Because of a lot of the cancers that we screen for, the age at which we start screening is different for those with family history, and it is also different for those without family history. So it is very important, if you are fortunate to know who your parents are, to know what runs in your bloodline. So we move on to the sweet old prostate gland. What is the prostate gland? Every one of you on this platform who is a man has one. Even me, there was a time my PA was like, "Doc, sometimes I think you have a prostate hiding somewhere." The kinds of things you do, women normally don't do these things. Yeah, but basically every man has a prostate gland. It is quite small. It's about the size of a ping pong or table tennis ball, or walnuts if you happen to be seeing somewhere you live. It is small, it is rubbery, and it is deep inside your groin. So I brought a picture to show you. It's actually sitting at the base of your bladder. That's your urinary bladder. Please, can you see my cursor? I hope you can. Let me get a laser pointer. Okay, so this picture is a picture of a man. This is his front, and this is his back side. And you can see a doctor's gloved hand entering his rectum, okay, through his anus into the distal rectum. That's the urinary bladder. And this fleshy pinkish substance you see surrounding the base of the bladder, that is your prostate gland. It is at the same place for every man. And so if you are lying down in bed, the space between the base of your scrotum and your anus, okay, your a-hole, forgive my French, that space is where your prostate is residing. And so anytime you apply pressure to this part of your groin, you are indirectly stimulating the prostate gland. But for us as medical practitioners, the way we palpate the prostate gland is to put our finger into the anus, up the rectum, and then anteriorly we are able to palpate the prostate gland. What does it do? Why do we need to have a prostate gland? It is really, really important for reproduction. Its main function is to produce fluid that joins that from the seminal vesicles and the sperm to form what we call semen. And semen is what nourishes and energizes the sperms to travel through your urethra into your woman's vagina to give you that fine baby that now you call your daughter or your son. And then also during sexual intercourse, the prostate contracts. And as it does so, it is releasing fluid, but at the same time, it is closing the proximal part of the urethra. Let me go back here. Okay, so that's the prostate gland. It sits at the base of your urinary bladder. And what happens is that your urethra, which is the tube through which urine will pass to come through your penis to the outside world, it runs through the prostate gland. And that is why as you grow older and the prostate becomes bigger, you start having problems with your plumbing works. Your urine becomes problematic. We'll get there in a minute. But during sexual intercourse, it contracts such that the proximal part is closed, so that urine will not come out at the same time that semen is coming out. The moment you are having semen and urine coming out at the same time, I need you to understand that there is something terribly wrong. The other phase of the prostate gland, it is a gland that is actually noted for providing pleasure for men. And that is the whole cornerstone or bedrock of the homosexuality trade, you know, because the prostate is quite pleasurable when you apply pressure to it. And some people have referred to the prostate gland as the male G-spot, because when you stimulate the prostate and the nerves that are attached to it, it is quite pleasurable. And so you don't even need to be a gay person to be able to notice that the prostate provides pleasure for a man. If you have a wife who is very sexually what do you call it, enlightened, one of the things that women do to give pleasure to their men is to stimulate their prostate gland. And so you can do that by inserting your pinky finger, your partner, your wife or girlfriend or whoever it is would put her pinky finger, well lubricated of course. She shouldn't have eaten shitolo so that her hands have a bit of spice around it. She inserts it into your anus, and once she massages the anus, it brings pleasure to a lot of men. The other thing that you can do during sexual intercourse to arouse pleasure from the prostate gland is to stimulate that perineum, the area of skin after where your scrotum ends to where the anus begins. That part of your perineum, when you stimulate it or you apply pressure, it can also stimulate a lot of pleasure for the male. And so we move on to the prostate problems in men. There are three very common ones: BPH, what we call benign prostate hyperplasia or prostate enlargement. We have prostatitis, which is basically infection in the prostate gland. And then last but not the least, you have the almighty prostate cancer. By and large, what we see very often in older men is the benign prostate hyperplasia. So as you advance in years, not only are your years increasing, but the size or the volume of your prostate gland is increasing with it. How do you know that you are having prostate problem? I'll give you a clue. I hope you get it. If you don't get it, then you have to forget it. But I'm going to explain how you would identify that you have a prostate problem. But basically, as young men or young boys, I know some of you know this because in your younger years, you even at your competition, you stand and you pee and you want to know whose own will go the farthest, you know. And that is another chest or your branch or so. But unfortunately, as you grow older and the prostate becomes bigger, it starts to squeeze or press on the part of the urethra that passes through it. And so now you have a little more problem getting the urine to go past the prostate to come to the outside world. One of the first things you notice, these are general signs of prostate abnormality, but I'll go to the specific pathology and what you would experience. You may have pain when you urinate or after ejaculation. It is not normal. There shouldn't be pain when you urinate or when you ejaculate. You may have pain in the penis, the scrotum, or the area between the scrotum and the anus. You may see blood in your urine. It is never a good sign. Sometimes you can see it just by looking at it. Other times we find it when we examine the urine under the microscope. And then you'd also find that your urine stream has become very weak. So you are not able to pee like the statue I showed you earlier. When you pee, the thing just lands at your feet. And then sometimes after you have peed, there's a little bit of dribbling. Okay, so you go back to the washroom a couple of hours later and you realize that your boxers are wet because some urine dribbled into your boxers. Okay, sometimes you have trouble controlling your bladder. And so when you feel the urge to pee, if you don't hurry up, you are going to start peeing before you get to the bathroom. Or you may find yourself getting up several times in the night to go and pee. At our age, in your mid-40s, usually when you go to bed, you don't wake up through the night. Or worst case scenario, if you drank alcohol or drank a lot of fluids the night before, you probably wake up once. But once you start waking up often, more than once, to pee in the night, it is an indication that there may be a problem. And that is because when you start getting prostate enlargement, when you go to pee, it's such a struggle. So you are not able to empty the entire bladder. So if maybe you have 400 mils of urine, you strain and strain and strain, and you get about half or 2/3 out. So by the time you go back to bed or you go back to your office, you still have about 150 mils of urine in your bladder. So you may feel that the bladder is not completely empty, but other times you may not feel the incomplete empty, but it doesn't take long, then you feel the urge to go and urinate again. There are times when you may find that your urine has unusual odor or smell, or an unusual color. Apart from the hematuria of the blood, you may find it looking more cloudy. Okay, so there's a picture showing you what hematuria, frank hematuria, can look like. And then when you are a boy, you'd be able to do this with ease. But as you grow older and prostate disease kicks in, the urine just lands right at your feet. If you are not even careful, it will fall on your shoes. And then the waking up thing we've spoken about. So benign prostatic hyperplasia, or BPH, or simply prostate enlargement. I have a picture here to illustrate a normal prostate, maybe somebody who is about 20 years, and then somebody who is about 60 plus. And in the image to our left, you realize that the prostate gland looks quite beautiful and pristine, and then the urethra is quite patent. This duct goes to the seminal vesicle, so this is where the semen will come, the sperms and the juice will come to enter the urethra. And so this is a very normal prostate gland, no problems with urinating. But by the time your prostate starts to enlarge, you realize that it compresses on the urethra, the part that is passing through it. And so you need to strain more, you need to put in more effort to get the urine to go past that point to come out. And this BPH, or prostatic enlargement, is a natural aging process thing. The good thing is that the fact that your prostate is enlarged does not mean you have symptoms. In progress. There are people who have very big prostate glands and they have no problem urinating. And there are people whose prostates are not that big, yet they have problem passing urine. And so the fact that somebody's prostate is 500 grams does not mean that you have worse symptoms compared to somebody whose prostate is 200 grams. The average size should go up to 40. Anything above 40 grams is enlarged. And so the symptoms, we mentioned some before, but you have frequent urination, you have difficulty starting. Hey, you go, when you are young, you just go, you move the thing, no, you start spraying. But when you start having prostate disease, when you get there, it's like an old engine. You have to start the thing. You spark it and spark it like 3 or 4 times before the urine will start coming. Sometimes it is difficult for you to stop the urine after you have started. And then we've talked about the weak flow and then feeling of incomplete emptying. Prostate enlargement is not dangerous apart from the fact that it will affect your plumbing works, your urine. And one of the difficult things for men at this stage is when they need to have a catheter passed so that they can pee. And a lot of men, of course, when you have a catheter inside, you can't do the doo-doo, and the doo-doo is really, really important. So the catheter being in is not a solution that I like. Me, even as a woman, I'll be very sad if my man is put on a catheter. So we don't like it. And so if you go into acute retention, we'll put you in a catheter to relieve the retention so that you are comfortable. But after that, you need to have definitive treatment. Either you go on medication or you have surgery. The surgery, there are 2 types depending on several factors, your urologist to help you to decide. But we have very minimally invasive surgery that will take out the prostate immediately around the urethra, and then we have quite advanced surgery that will take out the whole of the prostate gland. And like I said, your urologist will help you to decide when you get to that bridge. The next common thing that will happen to your prostate gland, and this is very common in younger men who are very adventurous, and you are probably sleeping with more than one person. It is infection or inflammation of the prostate gland. It is like what women get, the UTI women get. This is the male version. And one of the first things you notice is that your urine is cloudy. You may have frequent urination. Kakra, you want to go and urinate. When you go to, only small will come. You start having fever and chills. So, say malaria chill. When you pee, it is painful. You may also end up with pain in your lower abdomen and in your groin. And when you try to have sex, it is very painful, especially at the time when you have to ejaculate. And then sometimes there may be blood in your urine or in your semen. Treatment is quite simple. It is with antibiotics, pain relief, and then lifestyle changes. Of course, you get infected because you probably entered a hole that has a lot of bacteria that climbed up your urethra. And so the less holes you are entering, the less your chances of being infected and getting prostatitis. And then last but not the least, the grandfather himself, prostate cancer. It is the most common cancer in men when you take away skin cancer. And the risk factors, of course, once again, is increasing age. Unfortunately for us, our race as African American or African men, we have a high risk of prostate cancer. And then, of course, if you do have a family history, if you have a first degree relative, first degree means a parent, a sibling, or a child. First degree relative with prostate cancer, your chances are quite high. Even if it is your uncle, you still have a high chance. And unfortunately for prostate cancer, a lot of the times it is very silent and asymptomatic in the early years. Sometimes it may cause prostate enlargement, so you start having the signs of BPH. In fact, for us as radiologists or people in diagnosis, anytime we see somebody with an enlarged prostate, it is usually one of two things. Either it is just a normal enlargement or prostate cancer. Normally it is just enlargement, but we always will recommend a PSA. We'll talk about PSA in a few minutes, which is a blood test to help us to distinguish between normal enlargement and cancer. Because if it is cancer, the PSA levels are very high compared to if it is just normal enlargement. Somebody is writing on my screen. Hey, these are dull boys. So you may have urinary problems, you may have blood in your urine or semen, you may have erectile dysfunction. That is one of the first things that will bring men to hospital. At the end, if it is not affecting their performance, they will not come. So when you see a man come to hospital, chances are that at the end, it is affecting their erectile function. And then if the prostate cancer has been there for a long time without you knowing, and it spreads to your bone, you may start off with bone pain. Many years ago, I know somebody who had neck pain, went for x-ray of the neck, cervical spine, and then they discovered that there was something we call bone metastasis. That means that the cancer has spread to the bone. So he didn't have any symptoms. He was okay except for the neck pain. So they took a biopsy of the lesion in his neck. They took it to the pathologist, and it was then that they realized that the primary tumor was a prostate cancer. How do you test for prostate cancer? Roughly about 1 in 8 men would get prostate cancer at some point in their lives. The good thing about prostate cancer is that normally it does not kill. It is deadly. It may be the one that ends your life, but by and large, it is not one of those cancers that will quickly kill you. A lot of people with prostate cancer will end up dying from other causes rather than the prostate cancer, but it can also kill. And we don't have just one foolproof test to confirm that you have prostate cancer. There are several things that we'll do, including the PSA test, the digital rectal examination, and then a prostate biopsy. And then also there are other advanced tests we do when we are concerned that you have prostate CA, but that is beyond the screening level. So the first and easiest thing to do is a PSA test. It's a very simple blood test. You don't need to fast, you don't need to have any special preparation. We just take a sample of your blood and then we check the value. And once it is less than a certain value, we know you are okay. PSA is a protein that is produced by normal cells in your prostate, but also cancer cells can produce it. The difference is that cancer cells produce a lot of it, so once it is too high, you know that soldiers have entered a place they shouldn't enter. Okay, there are other reasons why your PSA will go up besides prostate cancer. Sometimes when you have prostatitis, infection in your prostate gland, your PSA will go up if you get prostatic stimulation either through sex or by a healthcare worker. It can increase your PSA level. And so normally if you are going to have a PSA exam, ideally it should be, let's say, about a week after or a couple of days after you've had a digital rectal examination or some very wild adventure during sex. What is the ideal age to start screening for prostate cancer? Do the PSA test. For the average risk man, around 50 years is okay. So you know by now how many years you have before you do your first screening. But if you have reasonable risk factors, including being black or having a family history, then by the time you hit your mid-40s, it is a good time to start monitoring. Normally by 70 years, you don't bother anymore, because if it's now that you are going to start getting high PSA levels at 70 years, in fact, something else will kill you before prostate cancer develops, if it ever will. You mentioned digital rectal exam, so we as healthcare professionals can also do a digital rectal exam to help us decide if your prostate is big, and then based on the consistency and whether it feels very hard or lumpy, we can have a fair idea the risk of prostate cancer developing in that prostate. It is not painful, but it is slightly uncomfortable or embarrassing. And if your prostate is larger than expected for your age, then we may suspect enlargement and we may ask you to go on to do other tests. But really nowadays ultrasound is easily and readily available everywhere, and so we spare you that pain and then just go right ahead to do an ultrasound exam that will evaluate the size of your prostate gland. If your doctor or healthcare provider has any reason to suspect that you are at risk of developing prostate cancer, they would go ahead and ask you to do a prostate biopsy. This involves me using thin needles to take pieces of your prostatic tissue to the lab so that we can look at it under the microscope. You normally would do this through your anus, okay? And as we do that, we'll use ultrasound from your lower abdomen to guide the needle so that we are taking tissue at the appropriate place without causing a lot of injury to you. This one is done under local anesthesia, so we numb the place so you will not feel the pain so much. And so if for any reason at some point in your life you are asked to go for a prostate biopsy, don't be too worried. It is easy peasy. It's not very, very difficult. Look, I mean, I'm talking as if I've had a prostate biopsy before. God forgive me. I pray to God that nobody on this platform ever gets prostate CA, but you are going to use this knowledge you are getting this evening to help other people. Anytime somebody is diagnosed with prostate CA, really it is not a death sentence. You may need to do other tests to help us decide if the cancer has spread or not. And that will help us to decide if it is likely to shorten your life or not. And then finally, it will help your doctor to decide which kind of treatment will be suitable for you. It will surprise you to know that sometimes we don't do anything. We just do watchful waiting. We just monitor you, monitor your PSA level and all of that, and then just leave the cancer there. Prostate cancer is actually one of the kindest you can find, although there's no kind cancer actually. There are several treatments available for prostate CA. Some of them are able to get rid of the cancer completely, but there are some too that will not be able to cure the cancer, and so it will control the spread of the cancer. It will give you symptomatic relief, because if you have pain from bone metastasis, you need to have some kind of analgesia so that you can have a reasonable good quality of life. And your doctor would always discuss the treatment options with you and help you to make a choice that would serve your interest best. The kind of treatment for prostate cancer depends on the stage. We do active surveillance to see how fast it is spreading. Some of the cancers are very indolent. They can be there for 5 years, 10 years, and they are still the same. Sometimes you need surgery, sometimes you need radiation therapy, sometimes you need hormonal therapy, sometimes you need chemotherapy. And guess what? There are times they may even advise that you take out your testes. And that is a very traumatic thing for a lot of men. Prostate problems can sometimes cause other problems. It can cause sexual dysfunction. It can cause urinary tract infection, because when your prostate is big and all the time there's urine sitting in it, nature doesn't like stagnation. Anytime there is water or any fluid sitting somewhere for too long, it tends to start to breed infection. And so with an enlarged prostate, one of the things you may have to fight with is urinary tract infections that are recurring. Sometimes they go on to form bladder stones. And then in very extreme cases, when the prostate is so big that urine backs up all the way into your kidneys, after that has gone on for a long time, it can cause your kidney to fail. How do we prevent prostate problems? I wish I knew how to give you a foolproof method. I'll be a very rich woman. There are lots of things we do to reduce our risk, but really all said and done, we all don't know what exactly is the foolproof method. Once you have a prostate, that risk still remains to a certain degree. For BPH, benign enlargement, it is part of the growing old process. And so you can just pray to God that although your prostate becomes big, it should not press on your urethra. Prostatitis, you prevent it by having very good hygiene, including keeping your penis clean. I think that Santa boys, but generally a lot of men don't like bathing. But the better your personal hygiene, the better the chances that you will not get prostatitis or infection going up into your prostate. And then I have another slide that will talk about diet, because a lot of the cancers, not just for prostate cancer, but a lot of the cancers that we all are trying to prevent, it all boils down to our diet, our lifestyle, exercise, and then our stress levels. Anything that is stressing you too much, please cut it out of your life. Life is too short. And a lot of the cancers have been linked to the stress levels that we are going through, especially as women. But I know there are a lot of men who are also going through stress, either from your wife or from your side chick or something. Whatever is giving you stress, please look at it and find a way to deal with it. And so diet. Eat healthy, well-rounded diet. And so I got this sentence in blue from a book, The Wealth Money Cannot Buy, by Robin Sharma. It's an amazing book. You should read it if you haven't already. I have a soft copy. I can forward it to put in the group. But in the book, Robin Sharma says that he lives by this mantra: if it doesn't hang on a tree, if it doesn't grow in the ground, if it doesn't have a mama, I ain't eating it. And so when you look at the beer that you enjoy so much, you look at the candies and the processed food, obviously they don't have a mother. It is not hanging from a tree. It is not growing from under the ground like carrots or potatoes. And so it is obviously not good for you. You need by all means to avoid processed food. As much as possible, cut it down. Eat things that are fresh and raw and organic. Cut out refined sugars. I'm still struggling with this thing, but I've come a long way. And then, of course, alcohol. I know that alcohol is a lot of people's best friend. It gives a lot of pleasure. If you cannot stop it at all, at least you can reduce how much you are taking. And then, you see, for those of us who grew up in Africa, and especially for those of us where in our homes, we grew up knowing that when you are going to eat, the majority of the plate is kabo. It is either rice, it is banku, it is fufui, it is gari, it is yam or ampesie. And then you have small stew and meat kakrebi, but it is sitting on the food. And that is what we grew up with. But surprisingly, as we have grown older and life has become better for us, and we can afford to buy more veggies and salads and more protein, it is so much a part of us that the cabo. At this age, we should all be slowing down on the carbohydrates and increasing the veggies in our diet. Make a fist with your hand, your right hand. The size of your fist should be the size of the biggest kenke you eat, the biggest banku you eat, the biggest fufu you eat should not be bigger than the size of your clenched fist. And that is a very rough guide to guide you. Instead of eating any kind of meat, if you have to eat meat at all, then when you go to the supermarket, buy the lean meat options that has less fat. And then eat fish that are rich in omega-3. Mackerel, salmon, trout, those ones are very rich in omega-3. Tilapia is not so rich, but it has a fair amount. I know that Ghanaians like tilapia a lot. And then eat fruits and vegetables. Remember, the mumpe fruit, bambachomundi kakrama yenwai. And then because as you go older, your metabolism is slower. You don't really need to eat as much as you were eating when you were in your 20s. If you are eating 4 balls of kenke at 20 years, at 40 years, you shouldn't be eating 4. You probably should be eating 1. Eat less salt. As Ghanaians, there we like our kobe, we like our kaku. Just say, another kind of flavor, but the salt in it is outrageously high. And so, if you really need to eat your kobe, then let your wife or whoever cooks for you soak it overnight and get as much of the salt out. You will still get the flavor of the kobe. And then last but not the least, drink a lot of water and green tea if you like it. Me, I don't like green tea, but if it is your thing, you can drink lots of it. It has a lot of health benefits. Exercise. You need to increase the amount of physical activity that you have per week. And so minimum of 15 minutes, 115 minutes, moderate aerobic. It can be brisk walking, swimming, cycling, anything that tickles your fancy. You can make it more fun by taking your wife and your children along. And then you also do some strength training, resistance training 2 or 3 times a week to help you combat natural muscle loss and boost your metabolism. You need to do some squats, some lunges, some chest press-ups, and some rows. And the exercise is not just good for your health alone, it also improves your stamina and performance in the bedroom. You know, a lot of women, when we hit our mid-40s, that is when some of the libido now goes up. So the men, you need to match up to our energy level. You say jump, you say how high, and then you are giving us good work. So please don't joke with the exercise. I think that I'm almost done here. Yes, that was my last slide. And so thank you very much for your attention.